Okay.
Hi, Colleen. My name is Zhane. I'm going to be your therapist today. So it says here that you have weakness and pain in your knee. So we're just going to go through an open assessment to kind of pinpoint what structures are affecting you and to give us a better idea, I guess, for treatment plan. So first, I'm going to start with observation. I'm just going to watch you actually get off the table and maybe just walk towards me and then back to the table. Okay, so obviously I can notice that they're limping, so weight bearing probably causes a little bit of pain. And you can take a seat back. So it's the right leg. So maybe I would know if there's any difference between symmetry of the leg. So maybe increased tone, some swelling. I would also know when you were coming in, or even in assessment, if you have any ambulatory aids like crutches or a knee brace. Okay. So from there, I'm going to move on to range of motion of the knee. So since I believe that that's the chief joint, I'm just going to get you to do some active ranges and let me know if there's any pain or discomfort with them. So first, I'm just going to get you. Can I get you actually sideline on this side? Okay, so I'm just going to get you actually to extend your knee straight. Straight. Is there any pain or discomfort there? Yeah? Okay. And then I'm going to get you to bend, so you're bringing your heel towards your bum. Pain with that as well. Okay. So from there, what I'm going to do is I'm just going to do some resisted. So I'm actually going to get you to push your leg into the back of my hand. Is there pain? Yeah? Okay. And then I'm going to get you to bring your leg into extension. Pain or discomfort? Okay. And then what I'm actually going to do is I'm going to get you to completely relax your leg, and I'm going to passively move your knee for you, and I want you to let me know if there's any pain or discomfort. Pain-free? Okay. And then extension. Okay. So from there, I'm actually going to get you, what we're going to do is we're going to rule out the joint above and below. So I'm going to get you in this position to just bring your hip up into flexion this way. Yep. And then I'd apply a little bit of overpressure. Any pain or discomfort there? Okay. And then I'm going to get you to try and bring your leg away from your other leg, so like up to the ceiling. And that's okay. And then a little bit of overpressure. Okay. And then I'm going to do the ankle next. So I'm just going to get you to bring your toes to the ceiling. Any pain or discomfort? Okay. Overpressure. And then I'm going to get you to bring your foot out to the side, like E version. Yep. No pain or discomfort? Okay. So I'm going to get you to take a seat back up. Okay, so next what we're going to do is I'm just going to do a quick scanning exam just because we don't know the mechanism of injury, and I just want to rule out any neurological structures. So I'm just going to start on one, and you're going to just let me know if you feel any different sensations on either side. 2, sorry, 3. Oh, I'm doing it detailed. Whoops. Okay, that's all. Okay, okay. So next, I am going to move on to, I think, functional assessment. So, are there any activities of daily living that you find are a bit of a challenge for you, that you find limited, or that you're limited with?
Like walking or going in and out of the cars.
Okay. Could you show me? I'm going to get you to stand up. Can you show me how you would do a squat? Mm-hmm. I'm going to get you to just have your feet hip distance apart. I'm just going to get you to kind of try and squat as far as you can.
Yeah, it's
Painful? Okay. And then considering that you still have a lot of pain with that, I would have maybe got you to fill out a lower extremity assessment or questionnaire before treatment. From there, I'm actually going to, you can have a seat back on the table, sorry. I'm going to rule out any neurological involvement. Yeah. Oh. I'm going to rule out neurological involvement. I'm quickly just going to check the L4 reflex just to see if it is altered at all. If it is, then I would go into more detail of reflex and cutaneous. But just to save a little time. It's just okay. Yeah. Maybe if I use this side. Okay. Okay, normal reflexes. So then, I'm going to move on to special tests. So what I'm going to do, I'm going to get you standing again, sorry. So I'm going to do one test, it's called Thestley. So I'm assessing for both lateral and medial meniscus, or to see if there's a tear or rupture. The test should be pain-free, but you're going to let me know if there's any pain or discomfort with any of them. So what I'm going to get you to do is I'm going to get you to weight bear on the right leg, and then I'm going to get you to bend your knee to about 20 degrees. If you need to use my hands for a little bit of balance, you can. And I'm just going to get you to rotate on your leg. Is there any pain or discomfort?
It's just a little uncomfortable.
Okay. Okay, you can stop. So a positive for that would be clicking or severe pain on either side, which would be a tear of the lateral and medial meniscus. So that was a negative. I'm going to get you laying back on the table. And what I'm going to do is I'm going to do a posterior sag sign. So I'm just going to have my client's knee bent there. Is that okay? Okay. So what I would do is I would just let my client stay in this position for a few minutes, and basically what I would look for is to see if the I think it's the tibia falls back on the femur.
2 minutes.
Is this going to be negative? Negative? Okay, and then from there, I'm actually going to get you to sit up and have your legs over the side of the table. So what I'm going to do next is I'm going to do an anterior jaw test for the knee. So what I'm going to do is I'm just going to add distraction here and pull the leg forward. It might reproduce some of the pain, just let me know if it does. Okay, so that test was positive for injury, strain or tear of the anterior cruciate ligament. From there, maybe move on to joint play. So I could start with a grade 2 distraction. That's painful, okay. And then I would move on to palpation. So maybe palpating the quadriceps to see if there's any hypertonicity, spasming maybe. There might be some edema around the knee. Yeah. So my clinical impression is that my client is suffering from ACL sprain or tear.